If you've ever felt a sharp electric pain shoot from your lower back or buttock all the way down your leg, you know how scary it is. People describe it as burning, stabbing, or like a lightning bolt in the leg. That pattern has a name, sciatica. Today, the narrator guides you through what sciatica really is, what's happening in your spine and nerves, and why both mind and body matter in this pain. First, what sciatica actually means. Sciatica is not just back pain. Medically, it's a form of lumbar radiculopathy, meaning a nerve root in the lower spine is irritated or compressed, and the pain is felt along the path of that nerve down the leg. The sciatic nerve is the largest nerve in the body, formed from nerve roots in the lower spine, usually L4, L5, S1, S2, S3. It runs through the buttock, down the back of the thigh, and into the leg and foot. So when one of those roots gets irritated, your brain doesn't just feel a spot, it senses pain, tingling, or numbness along the whole mapped out pathway of that nerve, often down one leg, sometimes to the foot. Common symptoms paint a clear picture: shooting pain from low back or buttock into the leg, numbness or tingling in a strip down the leg or foot, weakness in movements like lifting the foot or standing on your toes, pain worse with coughing, sneezing, or certain positions. Visuals here show a clean sagittal spine, labeled nerve roots, and a highlighted path down the leg, matching the narration without clutter. Next, the core problem: nerve root, disc, and inflammation. The most common cause is a lumbar disc herniation, often at L4, L5, or L5, S1. Picture the disc like a jelly donut, a tough outer ring called the annulus fibrosus, and a softer gel center called the nucleus pulposus. With age, repetitive load, or a sudden injury, tiny tears can form in the outer ring. The inner material can bulge or leak out and press near a nerve root. But it's not only mechanical pressure. Leaked disc material releases inflammatory chemicals, cytokines, and other mediators that irritate the nerve root and surrounding tissues. The nerve root suffers a double hit: physical compression and chemical inflammation. The result is a more sensitive nerve that sends pain signals in response to light mechanical stress that wouldn't normally bother it. Other causes of sciatica include lumbar spinal stenosis, narrowing of the spinal canal or foramen, spondylolisthesis, where a vertebra slips forward on another, bone spurs or osteophytes, and less commonly tumors, infections, trauma, or sciatic nerve entrapment outside the spine. Each cause can be shown with simple labeled diagrams: narrowing canal, misaligned vertebra, a spur pressing a nerve. Why does the pain feel so intense and electric? Nerve roots carry sensory fibers from the leg back to the spinal cord and brain. When irritated, they can fire abnormally ectopic activity. That abnormal firing is interpreted by the brain as burning, electric shocks, pins and needles, or a deep aching along a specific strip of the leg. This is neuropathic pain, different from the dull mechanical ache of a strained muscle. The brain and psychology tie in next. Sciatica starts with a physical event like a disc herniation or stenosis, but over time, the brain and mind can amplify or calm the experience. Studies show that fear of movement, catastrophizing thoughts, depression, anxiety, and stress are linked to more pain, more disability, and slower return to normal activity. This doesn't mean the pain is in your head. It means the nervous system is one loop: body or spinal cord, brain, thoughts and emotions back to the body. Threat, fear, and worry keep the nervous system on high alert, making the nerve root and spinal cord more sensitive. Conversely, positive factors, good education about the condition, confidence in movement, gradual return to activity, social support, and good sleep help dial down sensitivity and improve function. The natural course explains why many cases improve. Good news: many disc-related sciatica episodes improve over weeks to a few months with conservative care. Inflammation that causes pain also helps break down and reabsorb herniated disc material over time. So a disc that looks alarming on day one can shrink over months, reducing pressure on the nerve root. During this period, conservative management decided with a clinician may include staying as active as reasonably possible, targeted pain relief, physical therapy to improve mobility, core strength, hip stability, and nerve mobility, plus education on posture and realistic expectations. Think of it as helping the body do its own repair while preventing the nervous system from becoming excessively sensitive. When do doctors worry? Red flags demand urgent evaluation. New trouble controlling bladder or bowel, numbness in the groin or saddle area, severe or rapidly worsening leg weakness, severe pain after major trauma, fever, a history of cancer, or unexplained weight loss with back and leg pain. These signs require immediate medical attention. When does surgery enter the picture? Most people never need surgery. It's considered when pain remains severe and disabling after weeks to months of good conservative care. or when there's progressive neurological deficit or red flag features like coda equina syndrome. Procedures such as lumbar discectomy remove disc material, compressing the nerve root, and can provide faster leg pain relief for the right patient, though long-term outcomes may be similar to well-managed conservative care. In the big picture, sciatica is usually nerve root pain from the lower spine, often caused by disc herniation or spinal narrowing. The nerve root becomes irritated by mechanical pressure and inflammatory chemicals. The brain interprets that as sharp, radiating leg pain, sometimes with numbness or weakness. Psychological factors can amplify or sustain pain, while many cases improve naturally with guided movement, pain control, and rehab. This is educational, not medical advice. If you have leg pain, numbness, weakness, or any red flag symptoms, talk to a qualified health professional